Hi guys, if you're listening to me and you're able to access this, it means that you are here to catch up on the class of February 5th. Some of this may be repetitive. It'll depend on where we get to on to the 3rd, but it'll be a standalone unit that you guys will be responsible for. This will be the last of the introductory diagnostic units. Here on out after class. We are going to be starting new units that will follow psychology and halacha dilemmas, Torah and psychology dilemmas. And of course, today's lecture I like to call mental health and halacha, the Shtender and the couch. And what we're really going to do is we're going to take a look at the halachic parameters in treating mental health. So what are my goals for you before we get out of class? Basically, when you're done with our class today, you should be able to see where halacha and psychotherapeutic definitions of mental health collide and what can be done about them. You should also recognize the roles of all the collaborators. There are a lot of people going to get involved in issues when you're an Orthodox Jew who is going to seek treatment, but also wants to do so in a halachically acceptable way. It's also going to be an issue for a psychologist who's going to be called upon to with a halachic ben to try to figure out how I'm supposed to be involved and what I'm supposed to do about it, and also for the clergy, because after all, the clergy also have to figure out what they are supposed to be able to figure out. Is there any room for considering the therapeutic model? Until now, we've been talking about Shota and Kordaikas and all these things that we've highlighted, Rayon, or Shchora, Pesi. These were all legal definitions. If you remember back to our second lecture, we talked about the legal definition of mental health and mental illness, and then we brought it back into the last two lectures when we talked about halacha, and halacha classification wise seemed to only go in that direction, the direction being, of course, of a legal definition to be determined by a Beis Din. There must be some room, I guess, I think, there, and I'd like to figure out what it is. Where, in essence, does the Shtender reach the couch? By the way, when we talk about halacha and mental health, so, a lot of what we said, Mordechai, you and I have debated this openly, but most of us have discussed the issue of legalistically, is it all or nothing? If I'm putter for mitzvos, so am I totally out? Now, in our last lecture on Monday, we definitely delved into the idea that it's not all or nothing, that there are going to be different places of meeting, but we're going to see that come to into a degree very strongly over here. And is mitzvah responsibility really totally just Yisrael versus Shota? Who gets to decide the rules on the basis of what? Those are going to be some of the issues. And along the way, I love terms, guys. So by now you should know to expect to see terms. And when we're done, today's magic words are going to be tsar. They're going to include ones. They're going to include chol sheyesh bo sakona, chol she'ein bo sakana, mitzvah saseh, mitzvah lo saseh, and case conceptualization and diagnosis and the interplay between all of these. I know it sounds like a lot now at the beginning of today's talk, but by the end, I think they'll all come into play. So let's begin. A lot of what I'm going to discuss today came about from a conversation and then a subsequent with and subsequently a presentation from my dear friend and one of the best Jewish halachic clinicians today, diagnosticians today. His name is Rabbi Dr. Shmuel Mandelman. He's known more correctly as Dr. Shmuel Mandelman in the Orthodox Jewish community, one of the best diagnosticians. So Mandelman, Dr. Mandelman, my friend, and I basically had this big discussion and ultimately turned it into a presentation that was delivered in November in the Aguda Convention's Mental Health Department. His perspective. I'm going to add my perspectives into our lecture today. So Mandelman begins the discussion. He says, where this issue comes down to in his perspective, he says, I got a hard time because to me, he says, the real problem that everyone discusses between therapy and halacha is the definition of reality. Well, how would you define reality? So clinicians were supposed to understand and appreciate a patient's reality. There's something called a subjective reality. We're supposed to see what the patient's thinking and meet the patient at that point. And that's especially true for more of the supportive psychotherapies, where we're really less concerned with what is. If you tell a psychotic patient or a patient who's existing with just a regular delusion, even if it's a lower level or what you and I would call neurotic, if we were psychoanalytically so inclined. But I know, oh, that's not true. It doesn't help. So if I have an anxious patient, for instance, and the anxious patient is sitting and dealing with a particular concern, I'm always worried that the police, when I'm driving on the road, that I'm going to crash and run over somebody. And so therefore, oh, that's ridiculous. Telling them that's ridiculous. We don't usually do that. Does not remove the anxiety. We often need to be able to get where the patient is and help the patient work from the patient's space. How we do that is the subject of an abnormal psychology class or my clinical psychology class. There are different approaches how to get there. But ultimately, we're defining reality on the basis of the patient. But here's our problem. See, Torah doesn't work that way. As Torah Jews, reality is something that's defined objectively by the way of the Torah, and halacha considers that. So halacha is not and also we need to remember that halacha is not a post facto variable that needs to be reconciled. So we don't just turn around and say, okay, here's what I'm going to do. Let me go ahead and see how halacha can fit that. That's not the way we operate. If somebody is dealing with a particular obsession, we can't just say to the person, well, you just make it work. That's not the way true Torah Jews believe in halacha. Halacha is a system of operation. We're learning Sefer Zechariah in Nachyomi right now, and just the other day we came across the famous pasuk, "V'nasati l'cha mehalchem bein ha'omdim ha'ela," that we're going to have places to walk between the standing of the malachim that are there. Rosh Hashanah used to always point out to us that the understanding of mahalchin is the understanding that human beings have a superiority over angels, and that angels live a finite world. Jews are human beings are always building on it. They're always moving forward in life, but they walk with a guide map, and that guide map is halacha. So it's not something that we just work out afterwards, right? The only reason we're allowed to consider human experience is because halacha considers human experience. So now we're stuck because I have, on the one hand, trying to meet somebody where he is and how he sees his reality, and on the other hand, I have this objective reality that exists. And what do I do when the two things clash? What do I do when my responsibilities clash? Here's how I think our just defining things as shota or non-shota fail to really help us deal with our clientele. And so that's why the fourth of our classes, when we talked about the importance of diagnosis, comes into play over here as well. And with that, I think what we're going to be discussing is this halachic definition of distress. And the classic halachic definition of stress is tsar. And so I have to ask you a question. Tsar or distress, is that a finite halachic concept? We do know that when we talk about tsar, it can be weighed. One of the things that happens when one person damages another, there are different payments that we offer. Nezek, tsar, ripoy, shabbos, and boshes. There is a calculated price for distress. So is that supposed to be a finite concept like it appears over there in that concept? Or is tsar supposed to be something experiential and dependent on each and every person? How am I supposed to figure it out? How am I supposed to know? Now, if tsar is supposed to be a finite halachic concept, then the person who assesses it has to be the rabbi or the beis din. But if it's really more dependent on each and every individual, then the one who's supposed to be doing the assessing is the therapist. The problem is that as Torah Jews, we believe in the former, that it's supposed to be a finite halachic concept, but also as therapists and mental health professionals, we tend to favor subjective experiences. We like to get into those subjective experiences, and we want to be able to deal with those subjective experiences. How are we supposed to reconcile these issues? So in order to do that, I think we need to get to our next point. And what is that? Is emotional distress recognized in halacha or not? And I think the answer is absolutely. And I think in order for us to consider it, I want to cite just three examples in the Gemara. Maybe I'll have more. So the first case is a Gemara in Shabbos. It's in front of you on the slides, but the Gemara in Shabbos on Daf Kuf Chav Ches Amud Beis states the following: Amar Mar, Im Haisa Tzricha L'Ner. Let's say you have a woman who's giving birth, and a woman's giving birth is definitely in a situation of tsar, of distress. And we consider that woman, if she's giving birth if she's giving birth, she's what we call a chola sheyesh ba sakana. She's a woman who is certainly in danger. There's danger to her. There's danger to the baby. This is a dangerous situation. Now, let's say it happens that she has to give birth on Shabbos, and the question becomes: Does if there's a need for light for her birthing, so chaveirasa madlekes lasaner, her friends or whoever happens, the doula, the nurse, whoever happens to be in the birthing room with her, should light the candle for her. Says the Gemara Pshita, it's obvious. It's obvious the candle should be lit for her. She says she needs something. We're allowed to violate all the laws of the Torah for somebody who's in a situation of distress that can cause a threat to life, a chola sheyesh ba sakana. So obviously, lighting a candle on Shabbos is one of those issues. There are only three exceptions that we don't make a differentiation for, and those include idolatry, adultery, or murder. All right, but other than those, yes, we violate it. It's called pikuach nefesh. It's called the saving of a soul. So the Gemara says that's obvious. Pshita says the Gemara lo tzricha besuma. We're talking about a situation where she will get nothing out of it because she's blind. She's a blind woman giving birth. Since I would say, since she can't see it, right? So usher would be forbidden for us to to turn on the light for her. Kamash Malan, so what the Gemara is telling us is that by telling us that she's allowed to have the lights turned on for her, usuve misvadaita, that we do in order to make her calm, right? We are allowed to go ahead and if she will feel calmer as a result, then we are allowed to do that because of the alleviation of the emotional distress. So here's a question. What exactly is the Gemara saying over here? It sounds like the Gemara is saying over here that where there's tsar in the calculation, it is certainly possible that we would allow for the violation of the laws of Shabbos. That is to say, we can allow the subjective construct to be included and determining a objective situation. And this is quoted by the Shulchan Aruch Halacha in Orach Chaim. There in Orach Chaim Siman Shin Lamed Sif Aleph, the Magen Avram comments that that's only true if the people who are helping her need the light. What if she says, turn on the light, I need the light? Now, she's blind as a bat, so she doesn't need the light. But she thinks she needs it for the doctors. And the doctors or the nurses say, no problem. We're okay here. There's enough light here. The Magen Avram says, no, you cannot turn on the light. Thus, what he's really saying is, as far as the distress is concerned, there's a limit. There has to be a benefit to be achieved. But the Mishnah says, no. Even if it just makes her comfortable, and there are a number of Achronim who support the Mishnah over here, that's enough. Now remember, we're talking about violating biblical Yisurin. The Torah says you're not allowed to turn on a light on Shabbos. And so therefore, it sounds like the Magen Avram is saying that there has to be a physical benefit to the birthing process in order for us to allow tsar to be a factor. And the Mishnah Berurah is assuming, it sounds like, no, that the opportunity is so, even if it just makes her comfortable. So to answer the question, is tsar being considered apart from the physical or as part of it? That's actually a difference of opinion between the Magen Avram and the Mishnah Berurah. It's a wider disagreement, but for the sake of our conversation, let's just put it down as a machlokes Magen Avram and Mishnah Berurah. By the way, this has certain other practical ramifications in halacha. Let's say you have a pregnant wife, and your wife decides that she's going into labor on Shabbos. I have two kids that were born on Shabbos, and should my wife decide that she wanted me to go along with her, am I allowed to go ahead and go with her to the hospital? So Rosh Sternbach and Chuvas Vahanagos argues that if it's not obvious that she needs the husband, he shouldn't go. In other words, unless she's screaming, I need you to come, and I have a benefit, right? Then she shouldn't come. In fact, he's a little bit tough on the fact that men go to be in the birthing rooms, period. But Rav Neuvert, the famous author of Shmir Shabbos Keilchasa in Perek Lamed Beis Chaf Vav, argues that if the woman's physical condition would depend on her emotional condition, the halacha is that we are mechalel Shabbos, even according to the Magen Avram. So if her emotional state would be calmer, right? And therefore, as a result, it would directly impact the ability for her to give birth. She needs the husband. He's the best coach for her. So in such a situation, he should ride in the car. He should drive the car. However, if her emotional state would be calmer and there's no direct connection to the birth, she just says, I would feel better. So there he says it's harder to say you can violate the biblical rule. And it certainly would seem to suggest that he'll be able to violate an Isser D'Rabbanan. He'd be able to violate a rabbinic rule. So he can't drive in the car, but telling a non-Jew, please drive me, or having Uber or somebody take you, that would be more understood. Now, there are cases and circumstances where we weigh the issues of tsar no less than we weigh the physical. Maybe not to the level of chol sheyesh bo sakana, where we'll violate biblical laws, but even there, if the potential of the illness would create a threat to life, it could rise to that level, which has a lot of ramifications in post-traumatic stress or suicidalities, where there is a direct threat to life. And so whether there is a direct threat to life, the tsar, the pain that the person's in, may require us to violate biblical laws. That's case number one. Let's look at case number two. The Gemara here is in Yuma on Daf Pei Daled Amud Beis. And the Gemara says, what happens? Rosh and Ninala Delis Bifnei Tino. Let's say your baby child gets locked in the closet. So, the baby's starting to get a little agitated. Shovro motzio, you're allowed to break the door down and get the child down. Breaking the door involves a violation of the laws of Shabbos. Now, Hazaris Harezim Meshubach, the halacha is the one who goes this quickly. That's a good idea. The ain't sarach li Torah shus mi based, and you don't even have to ask a shaila about that. Whoa, that's pretty intense. Basically, what the halacha is telling us is because the child may panic, and because the child may lose his or her mind through post-traumatic stress, suggests Rashi. So then the child, it's better for us to break the door down and take care of the child so that the child shouldn't go crazy and God forbid have something terrible happen to him or her. But it would be better if we would break the door down. Better we should do that. Now, is that true only because it was a child? What would be the rule if it were an adult, not a child? So let's say you have a situation. The shaila was brought to Rav Yitzchak Zilberstein. Rav Zilberstein is one of the great poskim of our time. Lives in Bnei Brak, and the question came to him: would it be permissible to call an elderly person whose children didn't show to tell them everything was okay? Why are you making the phone call? Because the elderly person is likely to go crazy, right? So is that a issue? Is that okay? Even if you're just bringing Yishav Hadas or minimizing the tsar, right? So Rav Zilberstein says, in this situation, making the phone call yourself would violate the laws of Shabbos on a biblical level. You're setting pulses of electricity, etc., etc. He doesn't think that that's okay because he doesn't see this as a threat to the life of the elderly person. But there is a pain that's assessed there, and so having the non-Jew make the call, that would be ideal. Now, it doesn't mean that everyone who goes to the hospital should have a non-Jew call to spread the news. For Hashem, people give birth all the time, and let's say your mother and your father, the potential brand new grandparents, have no idea. You're staying home in your apartment in Washington Heights, and your parents are in Teaneck, Bergenfield, these foreign countries, West Hempstead, whatever the case may be, right? And your child gives birth on Shabbos, your wife gives birth on Shabbos, you have a brand new baby. Telling the nurse to call your parents is silly. There's no value. They don't know something one way, they don't know something the other way. Here, the issue is that the parent was expecting, and there would be it's stress and tsar. And so under those circumstances, when it comes to a child, there's a tiruf hadas element. We're worried about the tsar. And sometimes that could rise to a level of biblical proportions because the holy, the danger, can be one sheyesh bo sakana. When there is a situation of a chodesh sheyesh bo sakana, the laws of Shabbos are allowed to be put on the side for the sake of the laws of saving life. And that is true in certain cases. In other cases where the threat, the danger doesn't rise high enough, under those circumstances, we tend to be lenient. There is room, therefore, for a marriage between a medical model of tsar and a halachic model of tsar. Each case needs to be judged based not only on the event being locked in the closet, but also other parameters. Who's the person? What's the situation? Where's the threat? And those things make a difference in the differential of the diagnostics, which is where the mental health professional has to be brought in to be able to assess the situation. She just pointed out, Dr. Mandelman used to always say, how do we define emotional stress in halacha? He says, tsar is no different than physical pain. We have to measure physical pain when we assess how we want to deal with it on Shabbos. We have to measure the tsar as well. Tsar is a form of holy. It's a form of illness in regarding to health on Shabbos. There are other ramifications. Let's say somebody's on medication. Can one take medication on Shabbos? So again, generally we have a concern of something we call shchikas samimanim. There is a concern on Shabbos against taking unnecessary medication because of the concern. The rabbis were concerned that you may come to grind and on Shabbos, which is how they still make medicine that way. But it's not the way we go ahead and prepare medicine. We go to the drugstore and just get it. But we still have those rules at play. I say very often, most of the psychiatric medications that people take, uh, certainly the ones that require one to, let's say, a person taking antipsychotics or certain depression medication to keep somebody out of long-standing depression, there is absolutely no shaila as to whether you can take those medications on Shabbos, right? Those are holy sheish bo sakana. I think we'd force feed them to you if you didn't want to. But, even if in a situation where the medication is necessary because of a certain level of tsar that may not rise to a level of a danger, a cholish bo sakana, even on the level of a cholish bo sakana, there is a lot of room to allow for use of psychiatric medication. Which psychiatric medications would there be a less of a level where it would just be what we call mechush bialma, just a discomfort? That's a discussion that has to be held with your local rabbinic authority and the mental health professional, whether it's a psychiatrist. Sometimes the psychologist has to be around to help with the question, to help determine which way to go. And there are ramifications for taking medications on more important times, Yom Kippur, etc. And a lot of what the rabbis deal with, in terms of medication, is no less of a important issue when we're dealing with medications of the psychiatric state, which often happen before Yom Kippur and Pesach time, etc. I certainly get a lot of those questions at that time, and certainly I'm sure my rabbinic colleagues do as well. Let's talk about the third concept in halacha, or the third case. This case is from Bava Basra on Daf Kufnun Vav Amid Beis. And the Gemara quotes Rav Levi, who says, Konin kinyan mishchiv meira. Let's say a person is on his deathbed. So now there's already a threat to life. And he looks like he's about to go. He looks like he's totally finished, right? And the halacha is that we can go ahead and we can make a kinyan with him, even on Shabbos. We don't have to be concerned about Rabbi Elazar, who says that we're conducting business on Shabbos. Of course, one's not allowed to conduct business on Shabbos. The reason why we're allowed to do these acts of acquisition is because we're worried he's going to go crazy. Now, wait a second. If one is not allowed to go ahead and do business on Shabbos, how come we're allowing it over here? So the Rambam, the Tosafos, Rabbeinu Gershon, they all say, well, 1 second. There is no need for a kinyan. The truth is, when a person is a shchiv meira, when he's deathly ill, the rules are that once he gifts something over, once he transfers something by mouth, divrei shchiv meira kiksuvin ukemisurin dami. The words of the person who's deathly ill are as if they are handed over and ready to be passed through. Divrei shchiv meira kiksuvin ukemisurin dami, which means, therefore, that in that situation, you're not doing anything. It just looks like you're doing something by doing the act of acquisition. To do something that looks like you're doing something is a question of calming somebody down. That's not a problem on Shabbos. That's the way the Rambam and the others understand our halacha. The Rashbam and Tosas also sound similar, but others disagree. And they don't say that the issue is that you're not doing anything. They think you are doing something, but you're doing something only rabbinically. And so therefore, again, the idea being that when it comes to a person experiencing pain to the point where the person will lose his or her mind, according to the other positions, you're allowed to violate a derabanan. Rambam's taking a stricter approach over here, at least in this case, and says not so fast, right? And the ramifications have halachic import for us. For Moshe Feinstein, the Nigris Moshe, and Orach Chaim Chelek, I know that is a controversial volume, but let's work with it for the time being. And Simon Yud Ches says the only issue over here is for derabanans, right? In terms of the Kenyan, not by deoraisas, because if there's no potential harm, and by Yeshchimera, the guy is not going to kill himself; he's just going to pass away. And so Moshe says, in this situation, you can't go ahead and violate the laws of Shabbos just because the guy will pass away on his own. It's not like he's going to do anything. It's just going to work against him. Rabbi Ovadia Yosef, and Yalkut Yosef says, if therefore somebody is on his deathbed and he says to his family, come, they should only violate dinim derabanan. That is to say, have a non-Jew bring them, as opposed to doing an Isser D'Oraisa, because the person, you are not saving a life under these circumstances. The person is in a safe situation. Rosh Hashanah Auerbach disagreed with this idea totally, as his position is brought in Nishmas Avram, the halachic medical work by Professor Abraham S. Abraham. He says every moment that a person loses his mind is one that causes damage to the body. So the tsar of a person, the fact that a person experiences emotional distress, is going to affect the person's physical distress. And so therefore the person who is the patient who asks for his or her family to come, they should come as fast as possible, even if it means violating a deoraisa, because it's going to have a very, very negative effect on the person. Now, is that true across the board that Ramosha is a little bit more strict, or whichever way? The answer is no. Ramosha Feinstein also has a tshuva where which appears in Even Ezer Chelak Aleph Siman Samach Beis, that if one is not in any apparent danger, but if there is a chance that the person can become imminently in danger, that is also a cholesh yesh bo sakana situation. So let's say somebody's not actively suicidal right now, but he or she is in a situation where he or she can become suicidal. So under that situation, that could be a cholesh yesh bo sakana situation. Rav Vosner adds that saving a person from losing control over himself is also pikuach nefesh. So let's say we have a situation where there's a terrible accident or a terrorist action, right? So we call Hatzalah. Everybody knows Hatzalah is there to be able to come right away. And nobody challenges calling Hatzalah on Shabbos in these types of situations because, as we all know, that's considered pikuach nefesh. It's a threat to life. Well, what if Hatzalah were to have a psychiatric branch, right? Would the psychiatric branch, right, the mental health unit, be allowed to be dispatched to these types of situations to help people deal with themselves? So according to Ramosha, listen, if you have somebody who is in a situation where right now they're okay, but a traumatic event could lead the person to become a cholesh yesh bo sakana, that is a cholesh yesh bo sakana situation, and the person should travel. According to Rav Vosner, the Shevet Halevi from Bnei Brak, he says, what are you talking about? Even more so, the fact that the person may lose his mind is in of itself a pikuach nefesh. Studies show that the earlier that people get involved in first aid, mental health first aid, the better off they are in staying in reality. Therefore, it would follow that you are allowed to dispatch social workers, psychologists, mental health people on scene if their involvement will help the people from being and losing their mind. So again, assessing and knowing what is happening and what the parameters are, right, is a important principle. Now, again, if we are sending these people on Shabbos to these locations, and it's possible without any extra threat to only violate a rabbinic issue, not a biblical one, only violate a din d'Rabbanan by having, say, a non-Jew drive the car, right, rather than a biblical one in Issur d'Oraisa, so that would be better. Similarly, if a hotline would have to be maintained over Shabbos or over Yontif, and I know this was an issue at the first Pesach of COVID, having a non-Jew be able to answer the phone or answering the phone with a shinoi, your elbow instead of your fingers, right? That makes a very big difference. And again, assessment has to be made, and it's up to the mental health professional to be able to determine and help advise where the difference in timing makes a difference and who has to be able to get out there. Though those things come out of these types of issues. So again, um, a lot of the things that we'll take away, and again, as my friend Dr. Mandelman likes to say, when it comes to dinim dirabbanan, right? We know that on a lot of the rabbinic rules, we're told b'makom tsar lo gazu rabbanan. We know that the rabbi said where there's distress, the rabbis didn't insist. But you should just know that's not true across the board. That's not true. You don't have a right as a mental health professional to say, oh, it's only dirabbanan, everything is mutter. Everything is not mutter. So, however, specific and significant forms of tsar could make a person a chole she'ein bo sakana, a sick person who does not have a threat to life. This would allow a lot of things to go forward. Let's say a person is dealing with a situation whereby, as a result of certain mental illnesses, the person feels thirst. It's distressing. Maybe they shouldn't fast on a certain Dirabanan fasts. That's a question for the rabbi. But it's certainly one where the rabbis would have room, because they are Dirabanan fasts, to be more lenient than, say, Yom Kippur, which is a biblical one. That's not to say that when we deal with somebody who has anorexia nervosa, which is a certain body image disease, which often leads people to go ahead and starve themselves, and part of the treatment is getting them into a regular, ongoing regimen of eating. There may be a cholish yesh bo sakana situation. There may be a threat to life, and there are definitely chuvos. There are definitely guidance that appear from the rabbis as to how one should proceed. When it comes to a Shabbos, there's a difference between being mechalal Shabbos on a biblical issue, using a non-Jew, which knocks it down to a rabbinic, as we've been discussing throughout the lecture, and also an issur d'Rabbanan that can be done through a shinoi. Also, sometimes when we're dealing with rabbinic issues, we could say there's something called the shas hadchak, and under those circumstances, we can allow one to rely sometimes on a single position, and together when we're creating heterim that we otherwise might not be able to allow under those circumstances. So that's just some of the import I wanted to bring forth. But let's go ahead and I'm sorry, just added an extra slide that I didn't need to add. So let's cut that out and go straight, to this one. There are two categories of mitzvos we've been talking about. So most of the ones we've been talking about are mitzvos lo saseh. The Torah tells us don't do something, right? And the general rule is that when it comes to not violating a mitzvah lo saseh, right? In other words, you're not allowed to light a fire on Shabbos. Is a lo saseh, right? And a person, according to the Shulchan Aruch, has to be willing to forego all of his wealth, not to go ahead and give up. And so therefore, generally speaking, they're pretty strict. However, as we pointed out, there are dispensations, pikuach nefesh and ones, right? But it's important for us to figure out what is a risk to life, right? If there's a threat to life, we're told osim kol tzorchei chole v'shabbos. right? That we have a responsibility to do all the needs of a chodesh sheyesh bo sakana. There's a suicide risk, we've got to save that life. If there's a threat, we got to save that life. We also have a concept of ones, where a person who's a sig, who's machal Shabbos because of great pain, he might not be chayav under those circumstances, but we may have a responsibility to remember if he does what he does, right? That's okay, but we may not have the heter to go do it for him. The opposite is true when it comes to mitzvos aseh. When we get into mitzvos aseh, the rules start to change. Binyan Shlomo has a tshuva where he says that a person is not obligated to give more than a fifth of their wealth for a positive mitzvah. Certainly doesn't have to give more than a fifth of his body for the mitzvah. Pain that's of such significance, if as assessed by a rabbi, right, or by the Beis Din, pain that gets assessed in that situation would perhaps come into play over here. So if a person is physically pained to the point where he cannot sit in the sukkah, right, because of the pain in that situation, maybe that person is not obligated in the sukkah. When there are chuvas to the issue. Let's say I'm living in Israel and I've undergone some of the traumatic stress that exists because of all the different bombs that have gone off, from the missiles that have been sent forward, and now I don't feel comfortable in the sukkah. I know. You guys are thinking, what do you mean? There's nowhere better place to be than the sukkah. But let's talk from a perspective where we have a case where the person is afraid. Halachically, that person might not have an obligation to be sitting in the sukkah under those circumstances. I refer you to a talk on PTSD that appears in YU Torah. If you want to study that a little bit more deeply, there's a guy there who offered such a lecture. He may look like this. Just a question and just saying, but I'm not doing a commercial for myself. So, we have certain issues in Kibbutz Avim where we've been told, I've spoken to Rashata on a number of these occasions, where, some of the issues that come up because of a child who has issues with Kibbutz Avim, because of certain issues that have happened with parents, and where there is a tsar in such a significant level, in those situations, maybe the child does not have the obligation to give more than a fifth. And those circumstances, maybe you don't have to engage in kibbutz avim. You don't have to go around cursing them, right? But to go ahead and go actively, there are circumstances where that would have to come into play. Who makes that determination? Who has to be able to assess the level of tsar, of what's acceptable and not acceptable? Here's where the mental health professional serves a very important role. And what is the therapist's role in that case? So I'd like to suggest that the therapist's primary role is in good case conceptualization. Again, you have to remember, very often you will find people in our field, as you get further in, who say, I know exactly what's going on over here, but they can't categorize the disorder. So they'll throw a lot of personal things about this case forward, but you have to understand, being able to put a categorization of tsar on a person to properly assess the halachic ramification, that is dependent directly on the diagnostic formulation and the case conceptualization. We have to figure out certain questions. What's the primary diagnosis here? What are the other symptoms? Sometimes secondary symptoms play a role, sometimes they don't. And these things could become very fundamentally different and very important. How does a clinician understand the source of the distress? The fact that the person says, I hate God, does not mean that the person, therefore, does not have to deal with God. Where is the stress? Because we need to know if what we're doing is going to help the person manage the stress or alleviate the stress. How do we understand the presentation? What's the underlying cause? Because we want to do, how do we understand why things are presenting in the way that they present? And what are the factors that impact the presentation? Because if we can play all those things together in a good case formulation, then when we sit with a Rav to answer the questions that are being brought forward, right, we can be able to provide an explanation for what's going on and how the tsar is there, how to deal with the tsar. Person says, I can't wear tefillin. I had a case recently. because I live with the fear constantly that my tefillin are no good. It's important to understand what the fear is, where does the fear come from, what are the ramifications. Under certain circumstances, if there's really such a stress, the person may be exempt from the mitzvah of tefillin, but not all cases does it happen. And so therefore, the therapist needs to spend enough time going ahead and figuring out what exactly is going on over here so that the person should be able to go ahead and get the help that he or she needs. So now you've understood, and from the beginning of our semester until this point, how important it is to get a good diagnostic picture. What's the difference between legal and medical and now halachic classification? But to understand, halachic classification contains elements of both the legal model and also the role that's not legal, but has certain very important roles to play in terms of making sure that we're able to go ahead and provide what we need to provide to make sure that what we're doing for our patients helps keeps our patients strong, solid, and Torah true, and helps us know our role within that process. So again, I'll stop over here for today, and in our next series of lectures, I will start taking apart some of the other great challenges that we face. We're going to have a lot of fun. Everyone have a great week. I'll see you next week.